everybody. Good morning. Thanks so much for joining us. This is Harriet Kemick with Down to Earth, the show in which we talk about the issues that matter. And on our show today we're going to talk about deaths of despair, why poor healthcare is contributing to the deaths of people, and why poor healthcare is causing people to die. Poor people are dying. So we're going to examine the parts of the country where this is specifically happening. And is there anything being done about it other than we're not aware of it? And what happens to those folks? For some time now, we've been talking quite a bit on what happens to people as we encounter life crises. And I'm beginning to think that it's either I'm a prophet or it's either I'm seeing something, but we've been talking for some time about how coping with life situations tend to impact our overall health. And in some cases, it's impacting people's life cycles. What we're seeing is that people are dying from what I call preventable situations that are preventable. We know that there has been a spike in heart disease and strokes and COPD, which is pulmonary obstructive disorder. It's chronic because that means people are dying, they have a stroke, they have some sort of issue with their lungs. And COPD comes primarily from, smoking. So we know that these things exist, and over the last 30 or so years, there have been advocates about changing our lifestyles and how improving or changing our lifestyles to ensure that we have a balanced approach to life in terms of exercise, making sure that we have exercise and we have diet, that is a contributing factor to our overall health. But lately, in the last 10 years, we have come to understand that our mental health is just as paramount. That in fact, you're not going to live if you're not together mentally. And that you could be healthy physically, and that things could be going your way, but if you're not mentally aware, then you're not going to make it. And so what we're finding is that people are dying in specific regions of the country. And so today I wanted to focus on that just a little bit to get all of us to be aware of what happens, what is going on in us, in our minds, in our spirits, in our emotions. How are we reacting to life situations that are threatening our lifespans? It's a very sobering reality. So we're going to talk about that. Of course, today is Tuesday, December 10th. Tomorrow is the 11th of December. I celebrate my birthday tomorrow. And it's kind of fortuitous because they kind of put a damper on my birthday because they announced articles of impeachment. I don't want that to be the thing that people are talking about on my birthday, right? I want to go into Christmas kind of still optimistic, I kind of still hopeful, sort of, right? That 2020 is going to be the year of the manifestation for many of us, right? And that those of us who have worked hard all year, prepared for decades now, that the next decade is going to be the realization of everything that we have worked for and planned for. But I wanted to talk about healthcare, and I began my podcast this year in talking about our health. And I must have been seeing something into the future that somehow the end of the year was going to bring us to this point where we are literally talking about how much our health impacts our bodies, impacts our minds. And it's a sobering reality, my friends, when we sit back and think about the things that impact our health. And I wanted to have this frank conversation with you and to show you what social scientists are looking at and what the data is saying. I know many of us, some people dismiss science. They're like, science is irrelevant. I don't know how you can think that because our bodies are the greatest science experiment ever. If you think about it, you put food in one way, it comes out the other way, and it looks different when it comes out than when it went in. I don't know why you would think that that's a scientific experiment. I don't know why you would think how the earth seems to have cycles where it's summer, it's winter, it's fall. You get on a plane and you leave snow on the ground and you fly to another destination and there's sunshine and warm weather. Right now, We're having winter in this part of the world. In Australia, winter been long gone. Do you see? So in December is not winter for them. December is the opposite of winter. Do you see what I'm saying? So I don't know how you would think that everything is a science experiment, but be it unto you according to your belief. What you believe, that's what you believe. I can't fight you with that, right? But I can show you how science is going to work. And if it's up to you to choose to listen to the data and be guided by it or not. I find that most of us come from different spaces and different places and different environments. A lot of people choose not to believe in the data that is showing that there's warm air over the planet that is impacting weather. That's what's causing all this catastrophic weather. Because the warm air from our modern life, all this warm air, how do we not think about it? Because you don't see it, you don't think it. Do you see what I'm saying? So what happens is because we don't see it and we don't think it, we tend to think that it isn't real. So all the heat and generated from our furnaces, right? All the extra air that we use to power our cars or factories, right? And power our industries, power our homes. Why do you think that is not hovering over the planet that is contributing to catastrophic weather events? They might call it climate change. Maybe you don't like it because you think it's a bastion of liberalism thought and intellectual thought. But the truth is the truth. The facts are the facts. Whether you like it or not, it is what it is, right? Well, similarly, you're probably not going to liken to the ideas that I'm going to show you right now that are not ideas, that are scientifically based facts gathered from data. And here's what the facts are showing. Those of us now who are older, if you're over 10 years old, you remember the crisis, the 2008 financial crisis. In the 2008 financial crisis, a lot of jobs disappeared. People lost their homes, right? The subprime mortgage crisis, where the only people who made money were the boys on Wall Street. If anybody needs to be held accountable, it's the people on Wall Street, right? They made all the money, took all the money, and people were left with decimation in their lives. They were devastated. Homes were taken. People didn't have jobs because there was no money to lend to companies. And so there were no jobs available, right? And folks lost their jobs and lost their grip on reality. No job means no house, means no car, means no life. People need jobs to maintain their lifestyles. So when the 2008 crisis hit and people were faced with despondency and the fact that they were facing an uncertain future, it would be remiss of the rest of us to think that did not impact people emotionally and mentally. Well, we're now seeing the residue of that. 2008 is 11 years ago now, right? 11 years have passed. Well, what has happened in the past 11 years? All of a sudden, America has what? A higher, increasing death rate. We're noticing that people are dying in the primes of their lives. Children are losing parents. Employers are losing a talented and gifted workforce and skilled labor because people have chosen to swallow in despair. People don't have a choice. I don't think it's a choice. My mistake, it was not a choice. And so people don't have options. And what we're finding is this marked increase in death rates in certain parts of the country that is not happening in the coastal areas, like the coastal areas of the East Coast and the West Coast. People are not dying from the same kinds of illnesses. So this caused social scientists to look at this and to examine why is this? And the message was clear. After the 2008 crisis in manufacturing, where the auto plants and the steel mills closed their factories, those areas were decimated. The areas, Ohio, Pennsylvania, Kentucky, and Indiana. Know those places? Alcoholism, opioid crisis, drug overdoses, and suicides. Rampant through those areas. People in the 25 to 64 age group who are still in the prime of their lives. Now, overall, the United States still has a high life expectancy. There's no doubt about that. But it could be higher, and it would have been had the 2008 crisis not occurred. Now, we're supposed to be a wealthy nation, but the wealth, as we know in America, is not distributed. Nobody is looking for equal distribution of wealth, because then we would not be a capitalistic society. What we're looking for is at least a foothold that people can maintain and hold on to what they have. The stories of people losing their homes to rapacious capitalism and losing their lives is too much. Some people just don't cope well with that. Some people don't know how to start over. Everybody can't run to the East Coast, because then they would have a problem. Everybody can't run to California and to the East Coast to see if they can make it better, right? In some states, the states that are showing an increase in death rates as well, right, are what I call the whitest states: New Hampshire, Maine, Vermont, West Virginia, and Ohio. The whitest states. So social scientists were looking at that this is a particular dilemma amongst rural whites, that it was poor white people who were facing it. But when they looked at the data, that people were dying from COPD and heart disease, what they found was that it was distributed among ethnic groups. But here's the difference. There's some ethnic groups where these things don't happen, like Hispanics and Asians. They don't die. You know what we found with that? They have a stronger sense of community and a stronger sense of holding on to one another. Hispanics and Asians help one another as a community, as a group, as an ethnic group. They support one another. Traditionally, these deaths are taking place amongst poor whites and blacks. But when it comes to, and you find that even we know by now that people with a strong support system are less likely to commit suicide. So if they have people around them whom they can talk to, whom they trust, who will help them with hope. This is why I say continually that hope is a powerful thing. Hope gives you hope. Hope gives you power of life. Hope powers you to hold on in spite of the challenges that beset all of us. And there are challenges. You're looking at situations where people lost their jobs. Let's look at manufacturing, for instance, in the states I just mentioned: Ohio, Pennsylvania, Kentucky, and Indiana. In those states, what we found was that it was decimated simply because of the loss of manufacturing jobs. I mean, just recently, earlier this year, General Motors closed a plant in Ohio. You and I don't need to ask what's going to happen next. The diner is going to close. The mom and pop store on Main Street is going to close. People are going to start drinking and drinking and drinking. And in about 5 years, more people would have died who will tell glory stories about the days when they worked at the plant. Are you hearing what I'm saying? People are dying from despair. When you look at the 25 to 64 age group, you recognize that these are people who are at the prime of their lives. You turn 60, you have a whole wealth of wisdom and experience to offer to a younger generation. How is that wealth and experience, that wealth of knowledge and experience, being distributed if you're lying in a grave? The richest place in America right now is the graveyard. It's also the place of broken dreams where people gave up because they could not cope with the issues of life. And this is why I take angst with politicians who go out on the campaign trail and make promises that they know they will not keep just to get a vote, to get into office, to fulfill their own selfish desires. Because they know they couldn't keep GM plants open. They knew GM was not going to keep plants open because the world had changed. People are not buying small cars anymore. They're buying SUVs and trucks. That's a reality, right? People with the future is staring down on us with electric cars. That's not something that's never going to happen. That's something that will eventually happen. Do you see what I'm saying? Just like mobile phones were going to replace home phones, it's the same thing. You can't fight it. It's the advance of technology. So politicians, either they were misinformed or uninformed, but went out on campaign trails to promise people stuff in desperate areas, in desperate parts of the country that are being decimated, knowing they were not going to fulfill it, but were so hungry for power and wanted power at the expense of people's lives. Now, General Motors has closed the factories in those areas. The same thing is happening in urban Detroit and in Hamtramck, where GM is planning to close plants. The mayor of Detroit is offering GM incentives to keep the plant open because it affects over 1,500 employees. What is the value of 1,500 employees? That's 1,500 families who are going to be impacted. That means the factory worker who leaves work goes to the local Dunkin' Donuts, right? They stop at McDonald's to pick up something for the kids, right? They stop at the gas station on their way home. Their families go to the grocery store. That means those businesses that existed as a result of the factories being in place will be decimated. My daughter and I were somewhere recently, I can't remember where we were, and we were looking at how factory workers were impacting businesses. And as we sat there and observed, we realized that if the factory closes, those businesses will be totally gone. All of those businesses will be gone. Downtown Detroit is alive with financial services. Services is carrying the economy. If some of those financial services go out of business, the entire strip on Jefferson and Larned and all those streets that connect, they're going to lose their businesses. All those mom and pop stores, all the burgeoning stores in Midtown Detroit, all of that will be gone. And so when you look at it, you have to ask yourself, is this a policy decision? Is there something that can be done? Because poor healthcare does mean that people will get poor healthcare. And poor people can access healthcare. This is what the fight about Obamacare is all about. Reducing people's options, making healthcare less available to the people who need it the most. And as I said, politicians who have never had to live a day in their lives, who never had to experience want, who never even knew what it was like to see a dying parent that you could not control or stop the advance of disease, sit down and make promises to do things that benefited them. At the end of the day, it's all about them and how much money they and their family are going to make. And they make decisions about people's healthcare choices that impact directly how people live. In rural America, where they're mostly whites, they don't have healthcare up there, brother and sister. They don't have healthcare. So preventable diseases like heart disease and strokes and COPD don't get treated. People have cancer riding through their bodies because in those areas, industries have left chemicals in the ground. That means the water table is polluted. That means the water coming from the sky is just as polluted because it's a cycle. The water under here creates precipitation that comes down as rain and comes down as snow, blah, blah, blah. You know how that works, right? The water is contaminated in one place in West Virginia where death is rampant, where cancer is not just a disease, cancer is a plague. The factory that has pigs was pouring raw acid into the water system downstream. So the people who lived downstream didn't know they were drinking contaminated water for decades until people started dying. And trying to hold the company accountable became a political situation. That's what poor healthcare means. It means that you elect people who have no agency and have no investment in seeing people's lives being improved. My friends, we're at a turning point in our country. Where is America, dude? Where did America go? Went on a ship and sailed to Russia? Or did America just start sailing and just took off on its own and left the rest of us behind? Like, we're like, what was that America? What happened here? Where did America go? We're losing good people. Children are losing their parents before they're ready. You're a teenager, 18, 19, 20, and find you're losing your parent at 50, early 50s, late 50s. Your parents should be here to see you graduate and get married and start a life. Instead, you're visiting a grave where your parent is laid out. And for you to make it, you have to move out of the small town that has all your emotional connections and move to another part of the country to make it. The trauma, the emotional trauma that is contributing to people's lives. And all of this comes from politicians and their policies. Politicians who sit down with oligarchs, big business, large business owners, large companies, and say, this is what we're going to do to remain profitable. We don't care about the 3,000 people whose lives are going to be affected by the closure of the plant. It's not that General Motors could not retrofit the plant to make electric cars. They could have done that, but it was a political decision. It's not that General Motors or Ford or any other plant could not make the investment. They would rather take it to China. That's where American industry and manufacturing sail to. Take it to China, where they pay people 0.1 cents per hour to do the work, and then bring it back here. It's cheaper than to pay Americans to do the job. Because at the end of the day, they want to be an oligarch. They want to be big pimping and big balling. So now we have this dilemma. And it's not a thing like this is the whole country. It's just in concentrated areas. The Rust Belt, Kentucky, Indiana, Ohio, Pennsylvania. I don't know how Michigan didn't factor into that, because we went through a 2008 crisis that was unprecedented. They didn't look at what happened in Detroit and Flint after the 2008 crisis. After manufacturing jobs left Detroit, it was madness. People left the state. People who lived here all their lives, who grew up here, whose family lived here, right? People whose grandparents were here, came up from the South. People left Detroit looking for jobs. Young people graduated, couldn't get a job, had to leave Detroit and go somewhere else. Do you see what I'm talking about? So it's not like it didn't happen in other parts. I don't know how Michigan didn't factor into it. It has to be that they didn't look at what happens in black areas. The same thing happened. Detroit was decimated. It was a ghost town, downtown Detroit. You could, after 2008, you could drive on Jefferson and not encounter a car for a while. You literally could drive from Jefferson, from the Lodge, almost all the way to Grosse Pointe. You might count 2 cars. Buildings were empty. The police didn't make sense being down there because there was nobody down there. Detroit was taken over by vagrants and homeless folk. That's what happened after 2008. Buildings were boarded up. Businesses that have existed for decades disappeared. Where did all those people go? I used to drive around Detroit and say, so the people who lived in these homes, where are they now? Where did they go? The 2008 crisis was rabid through this area, because this area is dependent on manufacturing jobs to this day. Right now, GM is struggling, not financially, but struggling to come to grips with the new century that has dawned on it. Electric cars are going to be the wave of the future in 10 to 15 years. I don't know how they're going to sustain it in winter when things are frozen. I don't know how they're going to keep that going. I think people need to think about that. And meanwhile, the people who provide energy through oil are intent on keeping it going the way they like it, because they make a lot of money from oil. Right? I don't know how it's all going to work out. I don't know how electric cars, but I do know that they're going to find a way, especially in parts of the country where they don't have adverse weather like this. Maybe that's where electric cars will proliferate. But here in the Midwest, where things get frozen, solid, kind of steep, they have to figure that out. But they're doing the investment because to their minds, that's the future. They want to remain competitive. So they're not looking at retrofitting factories to accommodate the new technology that needs to be there so that cars can either use what they call flex fuel, ethanol and regular fuel, or using fuel or battery. Maybe that's where it needs to be. The car can use either battery and fuel. So if you're in an area where you can't get it charged up, you switch to fuel, right? So whatever their thinking process is, they have to think through this to arrive at a conclusion that is going to be mutually beneficial, not just to General Motors and Ford and Chrysler, but mutually beneficial to the population it serves. And there has to be some element of corporate responsibility, some moral thinking that is guiding their actions. It can't just be about the bottom line and we have to satisfy our shareholders and our shareholders want their money and their dividends. It has to be about what's happening to the people. I dare say, and I've been saying for some time, that America has changed. That the stuff that we used to focus on, where we were concerned about the well-being of others, that shifted. That boat sailed. People are like, I don't care about them. I care about myself and how many billions I'm going to make. Let's look at the opioid crisis, for instance. They've held a family who proliferated in the manufacture and distribution of drugs, the Sackler family. They've held them accountable. That's just a teachable moment to teach others, because there are other drug makers who are still sitting on the sidelines and so on. And when you look at how easy it is to have access to a drug like fentanyl, anybody knows what fentanyl is? Fentanyl is 100 times more potent than morphine. If anybody who has ever had a sick relative in a hospital knows that morphine is the most potent drug that can be prescribed to ease pain, especially people who are dying, people with chronic illnesses that life expectancy has been compromised, right? But fentanyl is 100 times more potent. What drug distributors have been doing is mixing fentanyl into heroin. So people who take drugs don't know that, it's not like you go to the doctor and they prescribe you a pill and they say the pill has this much dosage and you can only take this much dosage every 3 or 4 hours. People who are chronic drug users just use the drugs indiscriminately. They don't know how much of it they're taking in, which accounts for a lot of drug overdoses, because fentanyl has been processed into the drugs that people use recreationally. Now, why are people using more drugs? In the 60s, people were doing it for, to dance psychedelically and to feel good. They were not using it as a form of escapism. Today, people are using drugs to escape their reality. That's interesting, and that's something to focus on.